Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and today I'm delighted to have as my guest Dr. Shireen Kassam, who is a British hematologist with extensive background in plant-based nutrition and lifestyle medicine. Dr. Kassam is a member of the Royal College of Physicians and a fellow of the Royal College of Pathologists. She also is the founder of a group called Plant-Based Health Professionals in the UK, which does a good job in educating people about the benefits of plant-based nutrition and managing chronic disease. She's also the co-author of two books, Eating Plant-Based and Plant-Based Nutrition in Clinical Practice, which is a textbook, and also as a visiting professor at the University of Winchester in England, developed one of the first college-based courses in plant-based nutrition. Welcome, Dr. Kassam. It's a pleasure. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Thanks very much, Frank. Great to be here.
Yeah, I noticed that, you got into plant-based nutrition a little bit later in life, as some people will do. In your later 30s, it's been only about a decade plus. So tell me a little bit, as you were moving into your foray into the scientific world, what were the triggers, what were the things that urged you to segue into now embracing a plant-based lifestyle?
Yeah, thank you for asking. So I'd been vegetarian since 2001, since I qualified as a medical doctor. I just decided I didn't want to eat animals anymore. But it took me quite a long time to then consider my diet choices beyond that, specifically around dairy consumption and egg consumption. And once I truly understood the harm that we are creating by continuing to consume eggs and dairy, that was no longer aligned with my ethical and moral outlook on life. And so in 2013, with my two sisters, we adopted a vegan diet, really for the ethical reasons. But then soon, being of medical background, soon stumbled across the vast amount of data around plant-based nutrition and the ability for plant-based diets to support better health, optimal health, thriving and preventing chronic conditions, which was new to me. I'd been qualified as a doctor for 13 years at that point. And I was quite astonished that this education had not been delivered to me at any point in my training. And I had to then spend 4 or 5 years learning that from all the pioneers you're well aware of, that mainly from North America. So Brenda Davis and Neil Barnard and so forth. And that then led me to want to incorporate that into my everyday offering here in the UK, whether it be my personal, professional, or educational capacities.
Well, let's talk about that, because you're involved in a kind of an intriguing specialty that we don't often see associated with plant-based physicians. So let's talk about your interest in hematology. What was the real instigation of that in your life? What was the turn on for you to move in that direction?
Yes, that happened a long time ago, actually. It was during medical school when I did an extra year of a bachelor's science degree in hematology, and I had truly inspiring teachers on the topic, and that's really what drew me to the specialty, but also because it's a specialty that truly combines both clinical work and pathology, meaning the laboratory aspects of the diagnostics. And it's one of the few remaining specialties where you can see patients but also make the diagnosis in the laboratory. And I like that mix of being able to retreat to the laboratory when I needed more brain space, but also have that interaction with patients. So So yeah, absolutely nothing to do with nutrition and lifestyle medicine. So I specialized in hematology since 2004. But it's interesting because all aspects of my professional life really have collided now because there's so much overlap. So I may not be specifically looking after people with the conditions we usually relate to kind of diet and lifestyle, like
Right.
Cardiovascular disease, type 2 diabetes, hypertension, and all the conditions your audience well know. But I look after people with various types of cancer, like lymphoma and histiocytic disorders, but they all come to me with established additional chronic conditions: high blood pressure, high cholesterol, type 2 diabetes, cardiovascular disease, prior heart attacks. And the types of treatment we can deliver, their prognosis, their outcome is really dictated by some of these additional chronic conditions. Not only that, the treatments then we deliver for the cancers often exacerbate those underlying chronic conditions. So there is a real need and sort of gap in the offering we give to our patients around diet and lifestyle counselling. So my sort of initial interest in plant-based nutrition then broadened out to the wider field of lifestyle medicine, because I could see the need for my patients certainly would benefit from me understanding better the 6 pillars of lifestyle medicine. And then just to add to that, I think in healthcare in the UK and globally, we are very cognizant of the fact that healthcare is contributing detrimentally to the health of the planet. So, healthcare globally contributes 5 to 6% of all greenhouse gas emissions. If it was a country, healthcare would be the 5th biggest sort of emitter of greenhouse gas emissions. And so sustainable healthcare has really become a buzzword in every specialty. And there's 4 key pillars of sustainable healthcare: prevention, patient empowerment, low carbon alternatives, and then, reducing testing and reliance on healthcare. And you'll know that that's really resonates well with what we're trying to achieve through lifestyle interventions.
Yeah, let me take that a step further, because you still have your hands and your feet in medical education. I see that you still lecture at King's College Hospital. You have some of these positions. So I have to assume that these institutions are relatively conservative in their approach, meaning they're holding on to very old ways of doing things. How do you butt heads in that capacity, or do you just kind of put that on the shelf? I mean, when you're lecturing in a place like that, are you bringing in the things that you have just mentioned to me? And if you are, how is that received within the context of an institution like King's College Hospital?
Yeah, no, that's interesting to talk about because I had to change my approach. And of course, we all change our approach depending on the audience. So in my workplace, I tend to spend my time talking about lifestyle medicine because there's so few of us. There's 2 other diplomats in my workplace of 10,000 staff. So I take every opportunity to talk about diet, lifestyle, and its impact on health and the planet. Obviously, I became plant-based and want to reduce my impact on the planet because of concern for the animals as well. But healthcare really are not terribly interested in animal welfare. So I tend to leave that outside the workplace in general. But I think there's a great interest in more holistic approaches to healthcare. And it kind of depends how you sort of frame it. As I say, in cancer care, talking about living well with and beyond cancer, everyone can relate to.
No one can really argue with that, truthfully.
No, exactly. And then, as I say, there's a lot of action going on in sustainability. So if you're not talking about diet choices, either institutional diet offering or individual diet choices, then you're missing a big piece of the puzzle. So I really have been able to incorporate my sort of, outside the box passions with my everyday hematology life. And also to say I have been appointed as the sustainability lead for the Royal College of Pathologists just very recently. And it's interesting, they've already taken a decision to trial meat-free catering for their meetings. So it is becoming normalized to talk about plant-based nutrition and recognizing that preventative healthcare is the only way we're going to be able to support ourselves to live better on the planet.
I'm with Dr. Shireen Kassam, a plant-based hematologist from Britain, from the UK. We're going to take a very short break, hear from our sponsor, the National Health Association, and we'll be right back. You're listening to the NHA Health Science Podcast. Dr. Frank Sabatino here. Are you ready for an extraordinary adventure that combines relaxation, exploration, and vibrant health? Then set your sails for the NHA plant-exclusive cruises. Imagine cruising through exotic destinations, savoring delectable plant-based cuisine, and engaging in rejuvenating activities, all while surrounded by like-minded individuals passionate about health and wellness. These cruises offer more than just a vacation. They offer an opportunity to immerse yourself in the NHA's principles of healthy living. And they rank incredibly high on the ratings of eco-friendly cruise lines. We all know how important our oceans are, and our cruise partner, Windstar, is fully committed to this. Join us aboard our upcoming plant-exclusive cruises and experience the synergy of health and leisure. Delight in gourmet, SOS-free meals prepared by talented chefs. Attend informative workshops and enjoy the serenity of the sea, all tailored to nourish your body, mind, and spirit. For more details and to reserve your spot on our next adventure, visit healthscience.org and click the link under Travel. Don't miss this chance to indulge in a wellness retreat like no other. Elevate your well-being and make memories that will last a lifetime. And remember, your feedback matters. Please take a moment to leave a rating and a review wherever you're listening to the NHA Health Science Podcast. I'm Dr. Frank Sabatino, your host. Now, back to the show. Welcome back to the Health Science Podcast. I'm here with Dr. Shireen Kassam. And you also, pioneered when you were teaching at Winchester. It's interesting, you created this course. How did that go, and how did that come to be, and how is that faring in the context of the university setting?
Yes, thank you for asking. I think it's like with all things, it was a chance meeting with the Chancellor, the Vice Chancellor of the university, Professor Joy Carter, back in sort of 2018. And it happened to be that while she was Vice Chancellor, which is the most senior position within the university, she'd really fostered an environment with core values of compassion, social justice, sustainability, and that was what was dear to her heart. And it happened to be that she was also vegan for the reasons that I became vegan. And so we started talking about, the lack of plant-based nutrition within medical education, and they were about to launch a Faculty of Health and Wellbeing. And I just pitched the idea to her. I was like, well, no other university in the UK is offering an accredited course for health professionals on this topic. And obviously, I mentioned how T. Colin Campbell and the work that he's been doing at eCornell. And I was like, we need it in the UK. And I think she just took a punt, gave me an appointment for one day a week, and I was able to launch their first external course. So, most of the courses that they run are for undergraduate and postgraduate who are registered with the university, but I deliver my course as external, online, globally available, to everybody. And it's been going really well, thank you. We launched in 2019. It's going to be year 6. It's formally accredited for continuing medical education hours. We're recommended now by the Royal College of Pathologists and the Royal, so for the College of Irish GPs as part of their teaching and learning in sustainable healthcare. And we get a lot of healthcare professionals taking, over 1,000 healthcare professionals have taken the course to date. And it remains the only course in the UK, and we get excellent feedback. I think it's partly because people just haven't been exposed to this education. It just feels very new, but also relevant. And I do make an effort to keep it very much up to date. So every time we run the course, the references are updated, and I think people value that.
So it's kind of like a UK version of the eCornell program, basically.
Basically, all good ideas need to be replicated. So I've done that course.
It's something worth replicating. Colin Campbell is a very good friend of mine. So I know the quality that is. If you even come even this close to that, it's fantastic. So I think it's great. One of the beautiful things in England, I have a partner in England, so England is my second home. So I'm there quite a bit. I'm always impressed with the expansion of veganism in the UK, and you have, of course, the oldest vegan society in the world there, the Vegan Society. And I know you're on the Research Advisory Committee, and I'm just curious at how well and how much they're able to get their work done in terms of getting the message out across the UK and across the world. And the UK is a really open market for this kind of information, because I know how much there is such a vegan presence in the UK. So how's that organization doing? What is your connection with it? And how do you work together to foster what they're trying to do?
Yeah, luckily they are absolutely thriving, which is wonderful, and I'm pleased to be a part of a small part of the work that they do. I was just at their research advisory conference last week, and they said they employ 80 people now. So it's a really good size organisation with active members, and really they are the go-to society promoting veganism in the UK. And as you say, veganism, plant-based diets has become very sort of normalized in certain pockets in the UK, for sure. I think it's the big cities. If you live in the rural countryside, it's still very much sort of animal agriculture and limited knowledge on veganism. But certainly the big cities are buzzing with plenty of options for exploring a vegan lifestyle. And my role is just supporting their research work, of which they commission several surveys or other research projects and co-fund PhDs to further our knowledge into veganism. And yeah, it's great to be part of that. And I think what we bring as plant-based health professionals is that sort of credible voice around the fact that you can adopt 100% plant-based diet and remain healthy, if not, potentially reduce the risk of a number of common chronic conditions. And I think they value that input from individuals like myself.
I want to segue into something, because, you're also the founder of this group, Plant-Based Health Professionals, which is an organization obviously gathering professionals that are involved in plant-based health education and the management of chronic diseases, the reversal of diseases, which is something we see also in the US. Talk a little bit about how that came to be, how that's thriving, and how you see the involvement at a professional level happening in a country like the UK, in terms of people embracing this at the highest level of professionalism. So can you speak to that?
Yes. So we formed in 2018 after I'd done my personal education on the topic of plant-based diets and its impact on health, because I realized there was this gap in the education within the UK and in dietetic nutrition and medical and nursing education around nutrition care, plant-based nutrition specifically, and its role in preventing and sort of healing chronic conditions. So I wanted to sort of bring that to the UK. And as we've said before, copy other people's good ideas. We sort of really formed around the work that PCRM has been doing for decades in the US. So really copied them in terms of some of their work streams. So we provide education and advocacy to all groups of people, but our USP is that we really try and get into the healthcare curriculum. And we've had some great opportunities. We now teach in 4, if not 5, actually 5th one coming on board, 5 medical schools. We contribute to postgraduate education in dietetic and nutrition courses with lectures and workshops. As I said, we're the University of Winchester, that draws people in, and we use a lot of the resources that we've created at Plant-Based Health Professionals to enhance the learning environment on the university courses. We've also partnered with the American College of Lifestyle Medicine and are administering their International Board of Lifestyle Medicine certification on behalf of them for the UK. So this year we've sort of broadened our offering not only to sort of plant-based diet, but also incorporating all pillars of lifestyle medicine, which feels like the right move for us. So we continue to grow, which we feel very grateful for. And there's increasing interest from healthcare professionals, doctors, nurses, allied healthcare professionals to incorporate this into clinical practice. So and then this year we have spent some time on developing campaigns as well, and we're going to be launching our campaign called Plants First Healthcare, which really is centered around normalizing plant-based meals within every healthcare setting in the UK. And we're working closely with Greener by Default, who have now appointed a UK-based healthcare manager to help us with that campaign. So again, copying good practice from around the world, but just bringing it to the UK.
Do you feel that that's an expanding specialty in the UK, lifestyle medicine? Is that
yes.
something that you see people embracing, wanting to embrace?
Yes, absolutely. But it's not yet recognised as its own core specialty,
Right.
And I guess that's the case around the globe, bar a few exceptions. But I think people are finding opportunities in primary and secondary care to incorporate the learning and teaching of lifestyle medicine into their everyday practice. So the answer is yes, it's definitely growing.
So before we go on, I want to let people know where they can find you, where they can find more about you. So can you say the URL twice for the audience, please, Dr. Kassam?
Yes, so our website is the best place to follow our work. The short code is pbhp.uk, or it's plantbasedhealthprofessionals.com.
Okay, so either of those will work beautifully. That's great. That's great. Let's go into your specialty, because we know when we're talking about disease reversal and prevention, the hallmark problems that are usually brought up, of course, you've mentioned cardiovascular disease, type 2 diabetes, even obesity, things of this nature. Let's talk about how you would weave that into some primary blood disorders. I mean, let's talk a little bit about that, because that's a unique specialty. And even in the U.S., we've seen some interesting therapeutic intervention with things like lymphoma. So when you're dealing with these kinds of really your specialty disorders, what have you seen that you can share with the audience that you've seen an impact of plant-based nutrition specifically on blood-borne disorders, if any, if you can share that?
Yeah, that's quite a tricky question to answer, because, as you say, it's not sort of established within my specialty. And I guess the real point in the patient's journey where I discuss this is well, partly at diagnosis, but it's easier for patients to take on board once they've completed a course of treatment. And then, everyone asks, what can I do? What can I do to stay well? What should I eat? And that's I sort of draw on the cues from the patient to bring in the conversation about diet and lifestyle habits, really asking them the questions about, where they're at in terms of adopting healthy habits, and then coming up with a plan with them that's sort of achievable around eating more plants, getting more physically active, paying attention to sleep and stress and their relationships. And of course, I'm quite clear that we should avoid toxic substances like tobacco and alcohol. So it's at that point where people have started to feel better and want to stay feeling better. And we know that there's a kind of bi-directional relationship between chronic conditions that we're familiar with, like cardiovascular disease and type 2 diabetes, and the hematological conditions. So, for example, people with type 2 diabetes will have an increased risk of the conditions I look after, like lymphoma, leukemia. But in addition, people with leukemia and lymphoma, because of the treatments we give and the shared mechanisms of disease development, like inflammation and oxidative stress, they will then have an increased risk of developing cardiovascular disease and type 2 diabetes. So that's kind of how I weave in, the staying well, because people who've got a diagnosis of any cancer, whether it's hematological or not, will have increased risk of these other chronic conditions, which we know can be significantly reduced by eating more plants, moving more. And I think the other area that's developing, but we're not as good as at implementing, is during treatment. Like it's very clear that that supporting people to keep physically active supports them to have less side effects, recover better, have less of this sort of brain fog or chemo brain that people describe when their cognition deteriorates. And so, of course, we give people that advice around, make sure you keep physically active, but we don't necessarily give them the tools by which to do that. And I think I'm trying to sort of incorporate more of that into my practice. We've just started a Walk with a Doc group. I don't know whether your audience are going to be familiar with Walk with a Doc.
Well, we have Shop with the Doc. We have a few things in that regard. So I guess tell me about Walk with the Doc.
Yeah. So it's from the US. It's developed by physicians in the US, and it's now an international sort of campaign or initiative to incorporate healthy habits, including physical activity, into everyday practice. So every month we run a Walk with a Doc, opened up to staff and patients. And we've got a local park just next door to our hospital. We meet, we share information about a healthy habit, and then we go into the park and take a walk. And so it's just small things like that that sort of help to raise awareness, which is kind of my main sort of goal at the moment, is to sort of raise awareness amongst staff and patients who enter the hospital. And then obviously you have those individualized conversations with your own patients in the clinic room.
Shireen, in the United States, so much of medical practice has now become telehealth. In the UK, is your practice primarily face-to-face, or do you do a lot of online kinds of things too?
Primarily face-to-face, actually. But we are, it depends on the discipline, but we are moving into being able to deliver more sort of telehealth and telephone conversations. But sort of when people are diagnosed and talking about treatment and things, it's useful to be able to see people's baseline function and meet them sort of, face-to-face.
Of course. Yeah, I'm just wondering, because you have a national health service, of course, which is a universal healthcare approach, would you consider that to be more or less difficult in trying to get these innovations in medical care compared to a system that has privatizing like we do? What's your perception of that?
Yes, like with all things, it sort of depends. I think, I certainly face barriers at work to try and incorporate what feels like something new, even though it's such common sense, because we have quite a hierarchical sort of structure within the National Health Service. Our directives come from a higher upon us, and even though I'm a senior doctor, I don't get to kind of decide what we can do and what is too expensive or it's not a priority. So, I mean, it does sound ridiculous that supporting people to live healthier is not really a priority of our department, but it's not. We get money for delivering transplantation and CAR T-cell therapy and chemotherapy, and that's reimbursed at a fixed price from government level. We are, the NHS is running in deficit. It always has, and so there's not these extra pockets of money to set up initiatives, despite them being low cost or potentially financial savings in the future because of reduced chronic conditions. It's very sort of short-term thinking, annual budgets, not looking beyond the long term. But having said that, I think there's many opportunities to weave some of these sort of advances, and it's not even advances, is it? It's sort of these adjacent treatment options to our patients, and I think the fact is that we do deliver care to everyone that requires it, and is able to access our NHS care. So you have the opportunity to influence not just the healthy, wealthy. You have the opportunity to be mixing with people from all walks of life. And, we know those people from lower socioeconomic backgrounds suffer the most and have the least access to be able to instigate these healthy habits. And I think, that's the pleasure of the NHS, is that you see people from all walks of life and able to deliver that same message. So I think it kind of, it depends, but certainly more money and more flexibility around schedules and timetables and stuff would help, incorporate more lifestyle medicine approaches.
Well, in line with that, I know I read in your background that in 2022, you argued for the inclusion of these lifestyle pillars to the NHS. with the idea of saving billions of dollars, really. So how did that go, and did that go anywhere in terms of what you argued, or did it
No,
just
yeah.
stalemate?
I think it's difficult. I think we try and get the messages out and get the public conversation going. But as I say, unless you can really reach, the Department of Health and Social Care, the health minister, and obviously we've had a new government now, so we're going to be trying all over again. Unless you can reach those people in the top jobs, it's very difficult to sort of make those changes, from grassroots level. But as I say, there's a lot of sort of charitable organizations and non-profits like ours that are managing to weave in the message even into the sort of standardized healthcare service.
One of the things that separates the NHA in the United States from other vegan organizations is that we have a very long history of utilizing therapeutic water-only fasting. And I myself have fasted over between 10 and 15,000 people over the past 40 years. And we've seen some interesting preliminary results in things like lymphoma. I mean, Alan Goldhammer and the people at True North have seen it. And the autophagic pathways seem to really go into dealing with tumors and things in that ilk. What do you feel about that as a therapeutic intervention? And do you think there's any way that could ever be part of an NHS kind of an approach?
Yeah, I find it hugely exciting. And of course, I've been aware of the work you do and Alan Goldhammer and the cases that have been published around follicular lymphoma. And I think, there's some conditions within hematology, those slow growing, what we call sort of indolent conditions where people don't necessarily need treatment straight away. It feels very attractive to be able to offer something like this when people are told to, go away, come back in 3 months. People like to take control. And if that can be done through something like, medically supervised water fasting, it would be amazing. So I'm really excited by it. But I feel like the NHS is probably not quite ready for that.
That might have to be privatized for sure. Actually, you had one of the longest and oldest fasting institutions in England, run by Keki Sidhwa, who's an Indian physician. He ran it at Frinton-on-Sea, which is where he was located for about 50 years. So he did a lot of very profound fasting there. And the interesting thing about the fasting process, though, is that it doesn't even have to be done during the time of treatment. We now know that the Luongo work on differential stress sensitivity shows that, fasting a few days before even traditional treatments, chemo and the like, actually programs the cancer cells to be much more damaged by the chemo and protects the healthy cells. So that, is being now used even in some of the sophisticated medical institutions in the US just to help people deal even with conventional treatment. So that might be a starting point in a program like you see in the NHS, where it could actually be used as a precursor and a postscript to more traditional cancer care. And that may be an easier inroad for the use of that in a more traditional system like yours.
Yeah, no, I totally agree. And I'm also familiar with Voltalongo's work and the fact that, there is delivery of some calories, it's not complete fasting. So that also feels attractive compared to the sort of water only fasting. Yeah, I agree. I think, sadly, with all of these things, we're going to need more data in the specific.
Yeah, no question about
it. So there's going to have to be a study in lymphoma with a control arm. But
we can't keep doing these ends of 1 or 2. It's not working in a statistical way. We know that.
It's not going to.
So what's on the horizon for Dr. Kassam? What are you looking down the road at? Are you involved in any special projects, writing, research, anything that you can share with the audience?
Mm-hmm. Yeah, thank you. A few things to mention. So I mentioned already that we've got a food and healthcare campaign called Plants First Healthcare. And we are going to formally launch that on October the 16th, although there's already work going on in the background. At World Food Day, so people can look out on our social media and on our website around the launch of that project. And it really is going to be being launched with a policy report that's being produced by the UK Health Alliance on Climate Change, really calling for plants first in terms of meals. But also we're going to be sending an open letter to all healthcare institutions in the UK, asking them to commit to plant-based meals as the norm within their setting, and to work with Greener by Default to implement the same strategy that's been used in New York City hospitals. So this campaign is going to go on for a while. There might be a bit of noise here and there in the media as we go along, but I think that's what we're really working towards, because the kind of food delivery within healthcare in the UK is awfully complicated, and it requires local champions to take this to their workplace, and ask for, a change in the catering. So that's one thing. We are about to publish a research survey that we did. Michael Matudi, our research dietitian, has surveyed dietitians in UK and Ireland, and our paper's just going through the peer review process back and forth. So that will give us some insights into the dietetic profession and how comfortable they're feeling around shifting patients, clients to more plant-based eating. And then we are looking forward to taking forward our first group of healthcare professionals through the certification program in the International Board of Lifestyle Medicine certification. And we've just had a conference on Monday. We've got another online conference in November. So lots of events and conferencing along the way in the next sort of 12 months. That if your audience is in the UK, then have a look at our events. And we have all year round, we have online webinars which are accessible everywhere. So people can look up our educational offering and join in if it's relevant.
The problem with the dietitians is they have to be educated first in plant-based nutrition before they can embrace it as a way, as a policy that they can get behind. Because as you know, the education for most dietitians is so standard and so typical of, standard ways of eating. So yeah, that's a bit of a roadblock and something that you can fill in by these seminars and by these courses. As we wind this down, do you have any, final words you would like to share with the audience out here?
Oh, well, thank you. Well, thank you for the opportunity to share the work we're doing in the UK. It's really, on the big shoulders of pioneers, mainly in North America, as I've said. I would love it if people went to our website, because we have loads of free resources that we want clinicians and individuals to use in their personal and professional practice. So loads of downloadable fact sheets, articles, and as I say, our webinar program is accessible anywhere. So if you want some up-to-date education, please think of us and share with anyone else who'll be interested.
That's beautiful. I want to thank my special guest, Dr. Shireen Kassam, with being with us today, sharing her incredible information, a lot of what's going on to really change the face of healthcare in the UK and really throughout the world, and spreading this message of plant-based nutrition and managing diseases in a way that are much more in line with personal, planetary, and animal rights and health. And I want to thank everybody that really joined us today, because without you, we can't do what we do. I want to thank you for being here with us. And on behalf of the National Health Association, I'm your host, Dr. Frank Sabatino, and I look forward to being with you on the next episode of the Health Science Podcast. Dr. Kassam, thank you so much for being with us.
Thank you.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.